Cermorlin. What is it? After personally researching the hormone HGH myself over the last few years, also known as human growth hormone, I have found out about a supplement known as Cermorlin that is very effective. It may also be referred to as the factor for the release of growth hormone, or GRF for short. Cermorlin is a unique supplement in that it can increase the production of human growth hormone in the pituitary gland, which is released into the circulatory system. GRF, consisting of a specific protein that is made up of 44 different amino acids, causes the pituitary gland located in the brain to produce and release growth hormone. Many people typically supplement with HGH injections, but Cermorlin treatment treats this issue more naturally. How does Cermorlin function? Typically, when people experience specific complex chemical deficiencies, such as a serotonin or dopamine deficiency, they can rectify the problem by supplementing with an ingestible pill rather than an intravenous injection. These pills are absorbed by your body to make up for the shortage, which usually solves the problem. Typically, the supplementation can also consist of the precursors to the deficiency that exists so that the body is aided in producing the required substance itself naturally. With Cermorlin, it acts to support the mechanism that helps the pituitary gland release human growth hormone. The more straightforward method of HGH supplementation involves being prescribed human growth hormone containing injections to provide the substance intravenously. Supplements that work similarly but do not require a prescription to obtain are commonly known as secretagogues. These substances interact with the pituitary gland to make it secrete the needed hormone, but usually act in a much simpler way. The way Cermorlin works is much more complicated, as it is made up of 29 amino type acids that more effectively promote the proper function of the pituitary gland. Cermorlin side effects. When following a Cermorlin therapy course, a certain amount of people might begin to produce specific GRF inhibiting antibodies at some stage or another. Antibodies do not, however, always cause an adverse reaction to patients. And when a result does occur, they will usually clear up by themselves, without the need for any treatment. Since Cermorlin is administered by a localized injection, a moderate amount of swelling with redness can occur that might be painful in the section of skin where doses are administered. This type of reaction is standard with any treatment that requires a needle injection. This type of response is not something you should worry about if it happens. It will clear up in no time. The following mild reactions were reported by less than 1% of the people that participated in a Cermorlin clinical trial. Urticary. The appearance of hives on the skin is known as urticary. The red welts that develop on the skin can cause unrelenting pain and occur due to an allergic reaction. This reaction can take place at the section of the surface where the shot is injected, or it could be more widespread. Prednisone is a drug that can be taken in tandem with Cermorlin to eliminate this side effect, but you should first discuss this with your doctor. Flushed skin. The reddening of the skin is more commonly known as flushing, and is caused when your body responds to a form of stimulation. The face and chest areas are widely where this occurs and is usually itchy and inflamed. The difference between flushing and hives is that sores do not accompany flushing. A light dosage of aspirin usually solves this problem amongst Cermorlin patients. It should be noted that your physician must be notified if you wish to alter the medication you are taking. Hyperactivity. While some patients experience some drowsiness after taking Cermorlin, others might find it challenging to concentrate and feel restless, which is referred to as hyperactivity. Adderall is one drug that many children are prescribed to treat ADHD. This drug can, however, also cause natural HGH levels to be suppressed, which creates a correlation to exist between the patient's attention span and Cermorlin. Taking a dosage that is too big can be the reason this happens. Dysphagia. The medical term for when a person has difficulty swallowing is known as dysphagia. This typically consists of bouts of coughing and short periods where one cannot swallow and has been reported to occur amongst some patients. A qualified doctor should be contacted if this happens, even if it might not seem very serious, as it can lead to several other issues. Somnolence. The medical terminology for feeling drowsy is known as somnolence. Typically, this is not something one would see the doctor about, but it can become more severe, in which case it would be a good idea to see a physician for advice on how you can counteract the effects. Some patients have reported that the somnolence will vanish after a couple of weeks. So hanging on for a while could solve it naturally. Dizziness. Vertigo and short spells of dizziness could occur after the first shot of Cermorlin. This happens because the fabricated form of HGH can temporarily cause blood glucose levels to change. For a short while after the first shot, it will increase insulin resistance in the patient. This is the reason why it is advised to administer the injection before sleep. Also, remember only to take the shots once an hour has passed after a meal, to allow the body to absorb the chemicals fully. If the dizziness does not clear up, you are advised to contact a doctor. Mild headaches. Headaches can take place in some patients who take Cermorlin, and patients may require a visit to their certified physician depending on how severe the troubles are. The problems can range from a mild level to a more intense migraine. If a severe headache or a migraine occurs, it is advised to contact your doctor to discuss a dosage change or the prescription of a counteracting medicine. We can arrange legitimate Cermorlin injections. Most side effects happen due to incorrect dosages or injections not being applied correctly. It is advised you discuss your therapy schedule with your physician to help minimize any problems. It is essential not to forget that eating too close to the time of your injection can cause problems due to the sugar that is still in your system from eating the food. A lower dosage can also be prescribed by your doctor, which should clear up most issues. It is not advised to self-medicate yourself without first getting the okay from your doctor. Your doctor needs to make sure you are getting the correct dosage level so that you won't experience any adverse effects. Taking Cermorlin in too big of a dosage for an extended amount of time will compound effects and make it more probable for side effects to occur. One thing that Cermorlin does that cannot be reported as an adverse effect, but more of a drawback, is that there isn't any human growth hormone that is directly provided to the body. The supplement instead promotes the mechanism that causes the pituitary gland to produce the HGH. If the low-level human growth hormone problems that the patient experiences have occurred due to natural factors, the issues will have to be solved more directly to make it possible for them to feel the benefits of Cermorlin therapy. The number of factors will determine whether a person experiences human growth hormone deficiencies. Some of these factors are a low-quality diet, brain tumors, and bad living habits. Deficiencies in HGH that are caused by an unhealthy diet and certain lousy living habits should be able to be corrected by the patients themselves. By buying and eating better food and living better, these patients will start to stimulate their own human growth hormone production naturally. Please feel free to contact us if you would like us to help you decide which Cermorlin regimen will suit. If you found this video informative and would like to learn more about Sermorelin Acetate and HGH, please click the link below in the description of this video.